My name is Michael Moore, and today we're going to be demonstrating a pre-hospital stroke scale. So initially we're going to want to start off by getting a ANO status on our patient. So we'll go ahead and ask them person, place, time, and event. So, ma'am, what's your name?
Jeanette Moore,
And Jeanette, do you know what city we're in?
Murrieta,
And do you know what year it is?
2020,
2020. And do you know why we're called out today?
because I was feeling funny.
Okay, so this is an example of a patient who's alert and oriented times 4. Any abnormal responses to any of those questions would be an abnormal finding in her alert and oriented status. So to start off our stroke scale, we are going to ask our patient to give us a smile. So ma'am, can you smile real big for me? So this will be a normal finding. Both sides of her facial muscles are going to be symmetrical. An abnormal finding would be if one side of her face was not able to smile, so it would be kind of limp, and then the other side of the face you can see is trying to smile. And then moving on, we're going to have our patient test her grip strength. So I'll say, ma'am, can you grab my fingers real hard, real tight? So right now she has an equal grip strength. An abnormal finding would be if one of the grips was not as strong as the other. So then I'm going to go and have, ma'am, can you close your eyes for me? I'm going to raise your arm up like this. So we want to keep the palms facing up, and then we're going to be doing our arm drift test. So I'll have her close her eyes for about 5 seconds and keep her arms up. 1, 2, 3, 4, 5. So that was a negative finding. A positive finding would be any pronation in one of the arms or pronation and arm drift. If they're both to fall, that would just indicate weakness. We want to keep the palms up because it's going to be harder to keep your hands in this position. Okay, so you can put your arms down. And then we are going to move on to our lower extremity test. So I'll have her push down real hard on both my hands, and then I'll have you push up. So negative finding for that, there's going to be equal strength in both of her feet. Got the cat here. Positive finding is going to be any unequal strength in one of the sides. So moving on, we're going to have her repeat a sentence back to me. So I'll say, ma'am, can you please repeat the sentence, "It's always sunny in Philadelphia"?
It's always funny in Philadelphia.
Okay, so with this test, I'm looking for 2 things. I'm looking for any slurred speech, so if she's having any trouble getting the sentence out, could possibly mean that there's dysfunction with some of her muscles that allow her to speak. And I'm also checking that she's able to comprehend my command and then read the sentence back to me. So then now I know that her brain functions are working correctly. And that is our pre-hospital stroke scale.